is quite possible that that many CKD patients are started on dialysis too soon, although the definition of too soon will need to be specified. Clearly, currently, the only firm recommendation or guideline or thing that would prompt us to start or not start patients is the fact whether a physician would be reimbursed for the dialysis treatments offered to a patient. So one has to be able to justify the initiation of dialysis, but this can be done based on purely an estimated amount of kidney function, or if the kidney function is better than some kind of a uremia-associated complication that justifies this. Now, the trick is that many patients could carry on beyond these arbitrary estimated kidney functions of, let's say, 10 mLs per minute or 15 mL per minute if one is diabetic, without needing dialysis. And there it's a matter of how comfortable the physician is following the patient very closely to assure that there are no uremia-associated complications without starting dialysis. And frankly, this oftentimes entails a lot more work than just saying it's getting too complicated, let's start you on dialysis, even though a certain patient could carry on longer without dialysis. And the big overarching question is whether this is good or bad for the patient, and this is a question that hasn't been settled. A recent randomized controlled trial suggested that waiting longer may be beneficial, although the benefit was in essence measured as a time delay to start dialysis, so all it answered that it is possible to wait longer in most patients, but we don't know what the longer-term consequences are of starting dialysis maybe earlier or waiting longer. In other words, whether the dialysis treatment per se offers on aggregate more benefit, or maybe it's more detrimental compared to a patient who is not getting these treatments. And I think these are very intriguing questions that will need to be answered in the future.